Welcome to this week's Knowledge Nibble, where we're going to have a think about why massage must be followed by movement. So first of all, let's have a think about what we're trying to achieve with massage and range of movement. So when we go along and we first initially have a session with a patient, or whether it's something that we're doing on an ongoing basis, whether these might be weekly sessions, or they might even be as distant as 6 monthly sessions. But let's just have a little think about what we're trying to achieve in those sessions when we're hands-on with the patient. So what we want to do, there are lots of things that we could be saying that we want to try and do, and I've not made any secret of the fact that there is quite an argument in the literature and in the human world about what actually manual therapists do and what their value is. But all of that aside, there is definitely this element that we consider, and this is one of the most important elements, I think, and how we use massage and range of movement in rehab. This is the element that I think is really probably the main benefit of massage or any hands-on technique, is that the fact that when we have the patient with us and we have our hands on them, we have the capacity to reduce their pain. And we can quite significantly within a session reduce pain. So for those of you that have any sort of neck pain or muscle pain or compensatory pain, you know how painful it is. I'm using the word pain a lot here, but you know how painful that is when you have, muscle problems, compensatory problems. And like I say, anybody that has sort of any ongoing neck problem or back problem, you know how that feels. It's very, very, very debilitating. And with our hands-on treatments, we have the capacity within that session to massively reduce that. And then what we need to do is use that window of opportunity to then get some more movement in. And that's really what I'm discussing today, how and why we need to follow that up, that hands-on treatment. Why we need to follow that up with movement if we want to get the best out of it. So we're going to reduce pain, and that's with the pain gate theory. So if you bang your leg, you bang yourself, or you hit your toe, the first thing you want to do is rub it. And that's one of the reasons why that's the case, is because when you rub it, you can override that painful stimulus, and you can actually, in layman's terms, you feel the rub, which is a nice feeling and a comforting feeling. You feel that rather than you feel the pain. So that's one of the ways in which massage and sort of any sort of hands-on treatment can reduce that pain through the pain gate theory. Any of you that don't know that much about the pain gate theory, go off after this and have a research on that, just so that you understand how we are trying to affect that with any hands-on treatments that we give. So when we reduce pain, we can reduce tone. So a lot of the discomfort will come from muscles being in spasm and being in high tone. And that will also reduce range of movement. So if a muscle is shortened and it's tonic, hypertonic, you're going to reduce the range of movement, and it's a bit of a downward spiral. You don't move very much, you get more pain, and then you get more tone. So we want to try and break that cycle. So if we can reduce the pain, we can reduce that feedback, and we can reduce the tone in that muscle, which is really quite a significant outcome of massage. Therefore, we can increase the range of movement. So if we reduce that tone and effectively allow that muscle to lengthen, we can increase the range of movement. And that's why you can see quite dramatic changes in an animal. If you have an animal come in that's very stiff and very reduced range of movement, and you treat them, they walk away much better, much straighter, much longer stride length. And it's like, wow, that's really impressive. And that is great. If I can do that as a therapist, then I'm happy. But what we need to think about is then how we can have more carryover from our treatment, and how we can actually use that to benefit them long term. So that increase in range of movement, then we're going to increase confidence. So the animal's going to feel better. You're going to put your hands on, you're going to take away the pain, or you're going to reduce it massively. And you're also then going to be able to increase the range of movement and increase confidence, because you're going to move those joints, and you're going to move the limbs, you're going to move the spine into positions that it hasn't been moved into for a long time, And the animal's going to feel more confident about that. It's going to think, yes, I can do that. It actually feels quite nice to sort of mobilise and sort of stretch through there. And so you're going to increase the confidence for the animal. That in turn is going to increase their well-being. So if we go back to a few previous knowledge nibbles that where we've discussed pain and we've discussed fear, and so when we've talked about pain sensitization, that is all sort of linked into this. So if we can increase their confidence, if we can make them feel better, then they're going to be able to move better. They're going to reduce that sort of hypersensitivity to pain, and hopefully we can sort of move forward in a good direction with this. But if we don't use it, if we need to use it or lose it, and that's sort of a term that's thrown about quite a lot, but you really do need to use it or lose it. If you don't use that range of movement, if you go along and you treat a patient and you increase this range of movement, which is really, really beneficial, and you get them much straighter, moving beautifully, much more comfortable, much more sort of stretched out, but then that's it. You know, tomorrow nobody does anything with the animal, the next day nobody does anything with the animal. You know, very quickly the benefits of what you've been able to bring about with your treatment will diminish quite quickly over the next few days. So what we really need to do is work on increasing that. Once we've got this range of movement, we need to use it. We need to keep using it so that we can keep that movement there and keep all the benefits going for much longer. So that's why it's really important that we use movement to do that. So let's just have a think about, we're going to have to think about two types of movements. So we're going to think about mobilisation first. So mobilisation is the action of making something movable or capable of movement. Now obviously a skeleton, you know, an animal, a young animal has a huge range of movement and capability of movement, but through pain, through change in proprioception, through guarding, through maybe overwork, through underwork, through lots of different things, as they start to age, they will start to lose their range of movement in certain joints. Not always, but in cases we're working with, they will have lost range of movement. And that's through various reasons, and that's something that we need to tackle. So when we think about mobilisations, we can think about three different types of mobilisations. I use the word mobilisation. I'm not saying stretching. I'm not saying, you know, all these gliding and different terms that you can have. All I want to think about is the big term here, mobilisation, which is basically making something able to move again. So we use that as a broad term, and there's lots of different techniques within this, but just your general techniques or your general ways we can think about mobilisation. First of all, if we look at this dog over here on the right hand side, this is a passive range of movement that I'm doing here with the joint. So there's no input from the animal, I'm just moving the joint through a range of movement. So that's a passive range of movement. Then we can go on to active assisted range of movement, or assistive active range of movement. So this horse over on the left hand side, this is an active assisted range of movement. So I am using a bait, a carrot probably here, to ask this animal to move into particular movements. Now this is very valuable because they just stop using certain range of movement. They stop using certain actions because previously it's brought about pain, or again they've lost some proprioception there. They just don't use this example here of this horse. He just maybe was not using this range of movement. So we soften them, we make them feel better, and then we say, come here, you can come here now, you can move this way. And they think, oh yeah, I can move that way, and actually that feels quite nice. So we're using a bait, and we're actively assisting them into a position, into a shape that they haven't done for a while. This horse is actually on stability pods as well, so this is really was being done for a stability exercise as well. But that is really interesting that you can, you know, there are these ranges of movements that they're there, they just are not using them. So it's very important to actively assist them into those shapes. And then this horse here in the middle, just going over a pole, is just showing an active range of movement. So this is whereby We use some prop, like a pole, or cavaletti, or a step, maybe, something like that, to increase their range of movement. We can use water for this as well, for those of you that do hydrotherapy. So this is an active range of movement, and that has the added benefit of increasing strength as well. And then just finally, we're just going to have a think about strength here. Now, this is counterintuitive, what I'm about to talk about, but it's a good way to think about this, and it's something that I much prefer people to approach it from this angle. So if a muscle is hypertonic, what we tend to think, so when I say hypertonic, I mean tight. So muscle's tight, it's spasmy. We come along, we think, okay, let's rub that through with some massage and let's stretch it. You know, let's effectively stretch it and pull it, lengthen it by pulling it. That doesn't really happen. That doesn't work like that. So what actually happens is when a muscle is hypertonic, it's normally weak, and it actually normally needs to be strengthened. So if a muscle is weak, it will often be higher in tone. Because it's weak, it's contracting, it's trying to be shorter than it is. And, you know, for an example, let me put an example in here because it's easier to explain if I use an example. So let's think about back muscles, just because that's quite a straightforward way to think about it. So if the spinal stabilisers are weak, so in this case, talking with animals, we're thinking about multifidus, for example, which is a spinal stabiliser, deep stabilising muscle. If that muscle is weak or switched off, then there's going to be too much movement there, and the brain is going to say, whoa, there's too much movement, the spine isn't being stabilised, I need to do something about this. So the global muscles then, they're going to become very tight and very tonic, very hypertonic. And so you can use your massage to rub through, you can stretch those muscles, but unless we switch on the other muscles, unless we switch back on multifidus and we strengthen that, we're not going to be able to allow those other muscles to relax, because they are doing the job of that stabilizer muscle. So that example is a balance issue there. But actually the muscles themselves, if they're stretched and they're long, they'll very often be tight. Or it's a bit of a chicken and an egg situation. If they're tight because there is an underlying pain problem and they are guarding, through that hypertonic situation, they become weak because they're not functioning as they should, they're not using full range of movement, and they're just becoming weaker and weaker, so they become tighter and tighter. So that's a slightly counterintuitive way to think about it, but we don't want to, these muscles, we don't want to be stretching them, just pulling them, stretching them, because it might lengthen slightly as we're pulling it, but it's not going to maintain that stretch. So if we can train those muscles to be stronger, and they're stronger and they're doing their job properly, then they can actually relax. So we want strength and flexibility. We want them to be strong but flexible, and we want them to be strong in a full range of movement. So not just strong when they're being very short, and we want them strong when they're in a lengthened position as well. So the strength of that muscle is really very important. And if you want to long-term reduce tonicity in a muscle, you need to strengthen it, and you need to strengthen its antagonist, because you need to get this balance right. And the only way we can do that is through exercise. So that's just a different approach, a different way to think about it. And I just wanted to then, I guess in summary, just say to you what we're trying to do, what we want to do is we want to reduce pain. I always come back to that. It's always the first thing. We want to reduce pain. We want to increase confidence. Then we want to mobilise. So whether that's manually or through active or both. We want to mobilise. Now we've increased the confidence, we've reduced the pain, we want to say, hey, let's move here, let's move here. You haven't done this for a while. Let's start using this range of movement that you've just lost and forgotten about. And then in those positions, we want to start strengthening so that we can continue to reduce tone, reduce pain, etc. So your action this week is to review your current approach to treatment. Are you sending your clients away with movements to do with their animal at home with the aim of maintaining range of movement, the new range of movement that you've just managed to get for them through your hands-on treatment? Are you sending them away with exercises that are going to help to maintain that, to help reduce pain and to help reduce tone through increasing strength? Okay, so that's it for this week. If you're not signed up to Knowledge Nibbles and you'd like to be, please head over to our website at animalrehabhealth.academy/knowledge where you can sign up.